Public health messages about food have long relied on a language of fear. Cut this, avoid that, don't eat too much of this or you'll get sick, gain weight, or die early. While these warnings are grounded in science, they often leave people feeling overwhelmed, discouraged, or even defiant. Worse, they can create a narrative in which food becomes an enemy, something to fear, restrict, or control. But what if we shifted the tone? What if instead of warning people away from disease, we inspired them toward vitality, strength, and long-term well-being? Redesigning dietary guidance around empowerment, not just fear, could be the missing key to lasting change. The science is clear. Diets high in ultra-processed foods, sugary beverages, and trans fats increase the risk of chronic diseases. These warnings shouldn't be ignored. But leading with negativity often fails to change behavior. People don't respond well to shame or restriction, especially when those messages clash with deeply held cultural traditions, economic constraints, or emotional needs. Constantly hearing what not to eat can make healthy eating feel like punishment, rather than an act of self-care or celebration. Instead, public health should focus on highlighting the power of positive choices and framing food not just as medicine, but as a daily tool for energy, clarity, resilience, and joy. Take legumes, for example. They're inexpensive, high in fiber and protein, and support gut health and blood sugar regulation. Yet they're rarely featured in mainstream dietary campaigns. Or consider fermented foods, like kimchi, sauerkraut, and kefir, which can help nourish the microbiome and reduce inflammation, powerful benefits with growing evidence. Why are these not centerpieces of our nutritional messaging? Part of the answer lies in outdated strategies. Public health campaigns have often been designed as top-down instructions, delivered in rigid, one-size-fits-all formats. But people live and eat in a complex social context. Food is culture, emotion, history, and survival, not just biology. Instead of handing out rigid rules, we need messages that celebrate diverse food traditions, encourage culinary exploration, and make health feel attainable and personal. This means shifting public narratives toward what people can add to their diets, not just subtract. Eating more nuts, seeds, whole grains, herbs, spices, and colorful produce should be framed as a delicious opportunity, not a chore. This kind of language promotes abundance over scarcity, curiosity over fear, and long-term habits over quick fixes. It also helps build intrinsic motivation. When people feel empowered, when they understand why certain foods are good for them, and how those foods can make them feel better day to day, they're more likely to make sustained changes. This doesn't mean ignoring the real harms of unhealthy foods. But the framing matters. Rather than saying, avoid soda or you'll get diabetes, we might say, swapping soda for unsweetened iced tea or sparkling water can improve your energy, protect your heart, and lower inflammation within weeks. Instead of, don't eat fast food, we might highlight, cooking a simple lentil stew or stir-fry just once a week can improve digestion, mood, and save money. This approach also needs to account for inequities in access. Empowering messages must be paired with systems that support those changes. Affordable healthy foods, cooking education, community gardens, subsidies for fresh produce, and culturally relevant health programs. Without structural support, even the most inspiring message can fall flat. But with it, we can begin to reshape the entire food environment, not just one plate at a time, but across families, schools, workplaces, and neighborhoods. One final advantage of this empowerment-focused model is its potential to reach those who have tuned out. Many people, especially those who've faced years of dieting, health shaming, or failed interventions, feel alienated from health messaging. They don't want to be told what they're doing wrong. They want to feel hope, strength, and possibility. Food is one of the most intimate choices we make every day. If public health can meet people with compassion, creativity, and real-life solutions, it can start to rebuild trust. In the end, the goal is not just to reduce disease, it's to build health. Not just to prevent suffering, but to promote vitality. That shift in tone, from fear to empowerment, won't erase the need for hard truths about harmful foods. But it will make space for joy, autonomy, and resilience, all of which are essential for long-term change. Because people don't just need warnings. They need a reason to believe that a better way of eating is not only possible, but worth choosing.